Hi, it's Adrian from Dental Artistry. So what can go wrong with cosmetic treatment? We see some patients actually come in for a second opinion where they're really unhappy with the cosmetic treatment that they have done. I think the biggest thing, there's several factors, but probably the biggest one is that they're unhappy with the final outcome. I suppose there are a number of ways where we can overcome this. Probably the first way is actually just listening to the patient and really careful communication where we're really discovering what problems they actually have and what they want solved. Some patients come in and say, well, you know, they're concerned that their smile is very narrow, maybe the teeth are too small or crooked, or maybe they're slightly gummy in their smile, or the colour of the teeth isn't right. And by knowing exactly what their main problem is, we can then give solutions. The other thing is that it's really important for the patient to meet the ceramist or the technician very early on. And the reason for this is it's the ceramist that's actually making the final porcelain veneers. And if it's the technicians making the porcelain veneers and crowns, we really need to ensure that they know exactly what the patient wants when it comes to the colour and the texture and characterisation of the porcelain. The third thing is we really need to take a lot of videos and photos of the patients. When we take photos, we use this to do digital smile design where we're actually making sure that the new smile is balanced with the face. This is very important because if we only concentrate on the teeth, what will happen is sometimes the teeth are absolutely perfect but are not in balance with the harmony of the face. The second thing is video. Video is crucially important because if I tell someone to smile, a lot of the times they may do their selfie smile or a smile that they've learned in order to actually cover up certain parts of their smile. And if we take videos, we can actually see the dynamic movement of the lips and ensure that we can actually see the problems that they're talking about. And the last thing, of course, is making sure that there's a trial smile. A trial smile means that when the treatment's actually started, that a patient gets to try run their smile for 1 to 2 weeks. And this enables them to make sure that not only is the cosmetics correct, but also that the bite is perfect, and that phonetically when they speak, that the sounds that come out of their mouth are also correct. The other thing we sometimes see too is debonding. Debonding is when porcelain crowns or porcelain veneers actually come off. And with all dentistry nowadays, we do bonding. And bonding is probably one of the most technically important areas actually of dentistry, where we're actually using a certain sequence in order to actually bond porcelain to a tooth. The biggest problem we have when it comes to bonding is contamination. And the biggest contaminant in the mouth is, of course, saliva and moisture. So every time a patient breathes or every time the patient moves their lips or their tongue, we can get contaminants of saliva actually between or during the bonding process. And this will, of course, lead to early failure where the porcelain actually debonds or comes away from the tooth. The way that we ensure that this doesn't happen is by using rubber dam or a rubber shield in order to stop the moisture from coming on the tooth when we do the bonding process. And the last thing we often see is actually breakages. Porcelain is very strong when it's bonded correctly, is very similar to the strength of tooth enamel. So if a patient can break a tooth, they can also sometimes wear or break porcelain. The biggest problem we have with this is, of course, nighttime clenching or grinding, where patients are actually grinding on the porcelain. If this is the case, there's 3 things that we can do to actually avoid breakages. One is, of course, a night guard. If a patient's grinding or clenching at night, is to actually make a night guard. The second thing is actually we can do an occlusal adjustment or a bite adjustment where we're using a computer system called a T-scan in order to actually check the bite and to make sure that the bite's actually perfect. And the last thing is actually reviews. We know that there's a settling period for all porcelain treatment, and it's important to actually check the porcelain 1 week after treatment and 4 weeks after treatment to make sure that the bite and the inclusion is as balanced as it possibly can be. With all of these cases, again, reviews are very important. So whether it comes to ensuring that the patient's happy with cosmetics, that everything is bonded correctly, or that the patient's bite is actually correct, the review process is critical. If you have any questions, please give us a ring at 1-800-SMILEY. I look forward to one day seeing you in the practice.